Sears. I'm a professor in the College of Health Solutions and executive director of the Clinical and Community Translational Science Initiative here at Arizona State University. I've been conducting obesity-related cardiometabolic disease and cancer research since 1995 with a transdisciplinary and translational scope that spans molecular to the population health levels. I'm co-lead of the Cancer Prevention and Control Translational Team, which consists of faculty and students and community partners with common interests of reducing cancer burden. So I, in that context, am thrilled to thank you for joining our Health Talks webinar today, brought to you by the College of Health Solutions at ASU. Our college works to address the challenges facing people and communities to stay healthy, improve their health, and manage chronic disease. These health talks are one way we serve the community with timely and relevant educational information that also provides continuing education credit at no cost. And now for a quick few housekeeping items. First, this session is being recorded and will be posted on our website, asuhealthtalks.com. After the panelist presentations, I will moderate a Q&A session. So please submit your questions using the Zoom's Q&A feature and not the chat box. Also, at the end of Floris's talk, you will see, Dr. Wardenaar, you will see a QR code that will lead you to a website where it is the Health Talks archive website. And on this site, you will see links to both presenters' presentation slides. So we have that resource for you also. Finally, you will receive a brief survey asking you to provide your input about today's webinar. If you're interested in receiving continuing education credits, this must be completed in order to receive your credit. If you did not apply for CEUs, we would still appreciate your feedback to improve our series. So today, joining me is Cynthia McKeown. Cynthia is a Boston-based award-winning filmmaker and communications professional with a talent for communicating complex subjects in very human terms. Cynthia's most recent documentary, Unacceptable Risk, Dr. Margaret Kripke on Cancer and the Environment, tells the story of a prominent cancer researcher who rethinks her assumptions about the causes of cancer and the influence of toxic chemicals in our everyday environment. It was selected for screening at the 2022 World Cancer Congress and at the 2021 American Public Health Association National Conference, and has screened internationally at virtual and in-person festivals and other venues. Cynthia is a former producer-director at WGBH Television and was Associate Director of Digital Communications at the Dana-Farber Cancer Institute in Boston, where she managed the first ever forum on cancer and the environment to help cancer clinicians and researchers gain a broader understanding of the role of chemicals in the development of cancer. She received her Bachelor of Arts degree in government from Cornell University and Master of Science in Film from Boston University. Cynthia's presentation will be followed by a presentation by Dr. Floris Wardenaar. Floris is appointed as Assistant Professor in the College of Health Solutions at Arizona State University. A part of his research focus is on tactical athlete populations, such as firefighters. He is involved in the Firefighters Collaborative Research Project, FCRP. The purpose of this study is to test interventions to reduce firefighter serum PFAS levels. You're going to hear about that soon. Cardiovascular risk, cognitive disease risks, and epigenetic age. Per and polyfluoroalkyl substances, PFAS, are man-made chemicals that are commonly referred to as forever chemicals due to their inability to be broken down in the human body and the environment. In addition, he received a FEMA grant to determine the impact of hydration, self-assessment, and wildland firefighters. He has a keen interest in using simple sensors and measurements as part of field testing. We are so fortunate to have both of these health experts with us today as we explore exposing cancer examining the impact of environment and occupational factors. Did you know that certain occupations are at higher risk of developing cancer because of their working environments? According to the US Fire Administration, firefighters have a 9% higher risk of developing cancer than the general population. In today's Health Talks webinar, we will explore the environmental and occupational hazards that are linked to cancer and learn about 2 educational programs used for increasing knowledge about the impact of environmental factors on cancer, as well as communication strategies that raise awareness among clinicians, patients, and the general public. Our first presenter is Cynthia McKeown with a presentation titled Expanding the Narrative, Engaging Clinicians, Patients, and the Public in Learning about Environmental Links to Cancer and Pathways to Prevention. Cynthia, please take it away.
Thank you. I'm going to share my screen and get my slides going here. Okay. Can everyone see my slides? Yes. Good. Well, thank you so much. I'm very happy to be here and participating in this session. And as Dorothy said, sorry, my slides are not advancing. Let me just take a second here. There we go. As Dorothy mentioned, my presentation is about expanding the narrative, engaging clinicians, patients, and the public in learning about environmental links to cancer and pathways to prevention. And I have no personal financial relationships to disclose. I want to start by looking at the state of cancer in this country in some very broad strokes. And first of all, you know, there is some good news about cancer and some cause for concern. The good news is that cancer deaths have fallen in the past 30 years, and much of this is attributed to fewer people smoking, better early detection, screening, and new combination therapies, including immunotherapy. The concerning news is that cancer incidence has risen sharply in young adults, teens, and in children. In addition, cancers that are linked to environmental carcinogens, and some of those cancers include kidney, bladder, and thyroid cancer, are also on the rise. And racial and economic disparities in cancer risk can often be linked to toxic exposures regarding where one lives. One example of this is in St. John the Baptist Parish in Louisiana, which is situated in the notorious Cancer Alley. And St. John the Baptist Parish has the highest risk of cancer in the country. And this is due to airborne pollutants from a nearby industrial plant. And this situation is unfortunately replicated in many environmental justice communities across the country. I've had a longstanding interest in the relationship between toxic chemicals and cancer, and I wanted to do more to elevate this issue. In 2015, I was introduced to the Cancer-Free Economy Network, which is a cross-sector collaboration of 70+ scientific, business, and community-based organizations that works to address the fundamental right to a healthy environment and an equitable transition from toxic substances to safer materials. CFE's approach is to strategically shift the systems, practices, and mindsets that have created and helped to maintain an economy that relies on hazardous chemicals. This slide represents the strategic framework for CFE. I won't review it in any detail, but my talk involves the 3 highlighted areas. I'll focus on two specific projects, a short documentary I produced called Unacceptable Risk, and a forum on cancer and the environment that was a collaboration between CFE partner organizations and Dana-Farber Cancer Institute, a major cancer care and research hospital in Boston, where I worked for 13 years. And I'm going to start by showing the trailer for Unacceptable Risk, which tells the story of Dr. Margaret Kripke, a prominent cancer researcher and co-chair of the President's Cancer Panel, who rethinks her assumptions about the causes of cancer and the influence of toxic chemicals in our everyday environment.
I went into this with a number of preconceived notions. I learned an enormous amount. I thought that all chemicals were tested before they were put on the market. Turns out not to be true. I thought that anything that's known to be a carcinogen would be regulated. Also not true. And I thought that if there were regulations about something, that the regulations would be enforced, which is also not necessarily true. So that was a huge eye-opening experience for me.
So telling the story of Dr. Kripke's evolution and thinking is one example of how to expand the narrative of cancer prevention, a narrative that is almost exclusively focused on individual behaviors. For example, not smoking, maintaining a healthy weight and diet, and exercise. Excuse me, just a second. Now, while all of these behaviors are extremely important, they're not the complete story in terms of cancer development. The question that Dr. Kripke asks herself, and also the viewer, is what role do the thousands of untested and unregulated chemicals play in the development of cancer? So it made logical sense to document her story to reach a wide audience with her message. As both a pioneer and luminary in cancer immunology research at MD Anderson Cancer Center, Dr. Kripke is a very credible source. She's a strategic messenger who goes beyond the role of cancer researcher. As former co-chair of the President's Cancer Panel, she crafted policy recommendations for reducing environmental cancer risk and is a very effective spokesperson in the policy arena. Our goal for this film was to raise awareness of the prevalence of toxic chemicals in our everyday environment and their potential for elevating cancer risk. Our audiences have included cancer-focused constituencies, such as clinicians, researchers, patients, and the general public. We've held screenings with panels that include scientists at a variety of venues, such as film festivals, conferences, cancer support groups, and libraries. We've provided audiences with research-based resources for reducing their exposure to toxic chemicals where they live, work, and play. And we've made the video freely available to watch and share with colleagues, students, clinicians, and others. In this session, we'll provide a link to the full 15-minute documentary so that you can watch it and share it with others. And those who've watched the video have told us that they have a greater understanding of the risks of toxic chemicals and ways to reduce their exposures. And some have talked with their primary care providers about their concerns and sent links to the video. Others have contacted their legislators, asking them how they intend to address the problem through policy changes. And moving on to the second project, the goal of the Cancer and Environment Forum Series was to elevate awareness of environmental toxins within a treatment-focused cancer care and research institution by presenting the new science on the influence of environmental chemicals on cancer. The team organizing the sessions recognized several barriers for learners, and they include lack of knowledge of the evolving research regarding environmental chemicals and cancer risk. And specifically for clinicians, We were asking them to step outside their traditional role and consider engaging in population-level policy change and community-based public health initiatives. Another barrier is that the focus of most cancer centers is on care and on research that pertains to treatment, but they've largely been on the sidelines in conversations about environmental chemicals and cancer risk. Now, the biggest opportunity for us came through relationship building and developing allies at Dana-Farber who thought that this was an important topic and recognized that it was an area that had received little attention. And once key individuals at Dana-Farber were on board, they provided tremendous support, including recruiting a physician sponsor for CME and one for nursing professional development. They developed marketing materials and provided technical support. And CFE member organizations took the lead in developing the content, speakers, and panelists for the forum series. So what did we accomplish? Well, the forum was a successful collaboration with a major cancer center that resulted in new learning opportunities for clinicians, researchers, and patients regarding environmental toxins and cancer risk. The sessions were free, open to the public, and virtual, enabling participation by individuals across the US and also in other countries. The topics were not your typical continuing education offerings, yet they were of high interest to participants. And CME and nursing professional credits were available for each session, which incentivized participation. We had over 500 attendees for the 3 sessions from a wide mix of disciplines and backgrounds. This mix made for interesting and varied questions directed to speakers and panelists. And the overall response was very positive. One nurse stated in her evaluation that, quote, "This was the best professional development that I have attended in my 30-year career." These next 2 slides are from our session 2 evaluation. That session focused on air pollution and cancer. And this first slide shows that most of the respondents agreed that the session's learning objectives were met, and none disagreed. And this next slide indicates that respondents experienced significant gains in their overall knowledge and skill level because of the session. Before the activity, most respondents rated their knowledge as low to moderate, and after the activity, all rated their knowledge as moderate to high. So what were our key takeaways? Well, as mentioned before, relationship building was very important, particularly with the Cancer Center, as well as with other folks that participated in developing and executing the forums. And it was not a quick process. It probably took, in truth, about 2 to 3 years, but it was important to take the time needed to find allies and to nurture those relationships. It was also important to build partnerships with nursing organizations, schools of public health, medical associations, environmental organizations, and others. And we also really felt that the expertise of the presenters was a big draw. The committee was successful in recruiting an exceptional lineup of luminaries from universities, the Centers for Disease Control, the National Institutes of Health, National Institute of Environmental Health Sciences, and environmental and community-based organizations. So 1.5 years later, there are a few lingering questions. What's happened to the folks who attended the session? Did the sessions expand the narrative and help participants gain a greater understanding of the relationship between toxic chemicals and cancer risk? And what, if any, cascading impact will that have? And did these sessions make a difference in clinical practice? And if so, how? So I'm also very pleased to report that Columbia University in New York City took up the mantle and hosted a very successful 2nd annual Cancer and Environment Forum this past June with 225 attendees, both in person and virtual. And in closing, there are some resources that you can access. And as Dorothy mentioned, our slides will be available to you after this session. So these links will also be available to you. The first is the link to the full 15-minute video of unacceptable risk. The second link is access to all of the archived materials from the Cancer and Environment Forum sessions, and this includes video of speaker talks and slides and panel discussions and Q&A transcripts. It's a very robust site on the Dana-Farber Harvard Cancer Center website. And the third link is a link to the recorded session of Columbia University, their day-long Cancer and Environment Forum. And if after the session you have any additional questions, feel free to email me and I'm happy to talk with you. So thank you very much. This was a pleasure and I look forward to your questions and comments. I'm going to stop sharing my screen.
Fantastic, Cynthia. Thank you so much. Remember, if you have questions, you can start putting them in the Q&A box. We'll get to them after Dr. Wardenaar's talk. So please go ahead and put them there or jot them down so you don't forget them. We're going to go ahead and have Dr. Floris Wardenaar do his presentation about firefighter exposure and cancer risk. So Floris, you have the floor.
Thank you, Dorothy, for the earlier introduction. Thanks, Cynthia, as well for your informative talk. It's my turn to talk about firefighter exposure and cancer risk. So before I start, I have some disclosures that I want to make. I got some funding over the last couple of years from organizations on the left, not related to any firefighter research. And then on the right, there are two funders that are currently funding the research that I'm involved with firefighters. And today the talk mainly will be about the one on top, sponsored by the Arizona Board of Regents. So if we look into firefighter risk, based on their occupation, obviously they have risk going into burning places and so on. But there is also the risk, for example, to end up in cardiovascular events. Not many people know that. A lot of the focus have been lately also on cancer. And then there's other risks too that come with the job. For example, issues with sleeping or potential lifestyle issues as well. Today, we'll talk about cancer risk, and we see that the incidence of cancer is just higher in firefighters. So in the state of Arizona, a lot has been going on in the last couple of years, looking into firefighter research. And an important driving factor there is Dr. Jeff Burgess from U of A, who is also the PI on both of the studies that are currently listed here. And so at first we have the firefighter cancer cohort study, which is a 30-year-long study nationally funded by FEMA, in which we try to follow up firefighters for a long term. And that is, a huge endeavor. And we sort of connected the FCRP, the firefighter cancer risk study, to the FCCS. And how that works is, for example, you can see here the agenda of the FCSS that was started a couple of years ago in 2015 with many other university partners in the US. And now currently we added on the Arizona PFAS study, or FCRP study. So that's so that you can see that a lot is going on nationally, but also in the state of Arizona. So what we know about firefighter exposure is that due to the job, they are subject to products of combustion. That can be all kind of toxins that come into the air just by burning stuff. That also includes polycyclic aromatic hydrocarbons, PAHs, that I will talk a little bit about today, and also the PFAS that Dorothy was already referring to. And we know that firefighters have been reported to have higher PFAS concentration in their blood. It's part of their turnout gear as part of making sure that they're safe. At the same time, it may influence their health in that way. And it has been part of synthetic Class B firefighting foam for years. And that has now been limited. They're phasing out the use of those firefighter foams. But let's say 10 years ago, probably most of the departments still were using that. So there are different strategies that firefighters can take to mitigate risk exposure. So at first, there is the inhalation of the combustant. And normally when they go into a space, when they perform their firefighting exercise, they have breathing apparatus. But during overhaul, it has become more custom to use it too. And that's because even though the fire is done, the toxins can be part of their gear. And if it is cleaned, it can still contaminate them. And that is by inhalation or maybe by dermal exposure. And here you see some strategies that they have. Post-fire washdown is a good strategy, but you also need to be careful that you are not getting dermal exposure then. And then there's obviously the normal dermal transfer, and therefore they, for example, use wipes, they take showers, and they change clothes, and potentially maybe even sauna can help. If you start talking with firefighters and ask them about what they think they can do based on what we know, they can come up with all kinds of strategies. And this is just a very tiny overview of a paper that was published in 2020 by Dr. Jeff Burgess. And as you can see, there are some fireground operations that the firefighters identified as things that they wanted to take action on. For example, make sure that there is PPE used during cleanup and that there are visual reminders for health and safety. So the ones with the exclamation marks that you see here, they were actually tested in this study. And they did something interesting, I think. They collected urine samples of this group of firefighters here in Arizona. I think it was mainly Tucson. And so that was at baseline, and they were measuring the PAH level in their urine. And as you can see, if you then go into a fire, and you take urine sample again, then the amount of PAH is way higher. And that's a type of chemical or chemicals that have been associated as marker for firefighter cancer exposure and risk. So what they did then was develop those interventions, work with the firefighters for a while, and make sure that they were implemented. And after that, they collected again urine samples in engineers, firefighters, and in captains. And what you can see is that specifically in the engineers and in the firefighters, the amount of chemicals were reduced after implementing those interventions. I'm not sure why the captains don't show that clear reduction. At the same time, that was a very small group, which may influence the results a little bit. But on the total number of firefighters that we have, the paper concluded that those implementation strategies can be effective in reducing at least the number of chemicals detectable in urine. At the same time, there was some interest in looking into the impact of sauna on losing those PAHs as well. So what you see here is a graph showing the results of 12 firefighters going into a simulation together with 12 other firefighters, parallel groups, and they were going into, I think it was in the Scottsdale simulation burn center. So they were exposed to materials that were burning. After that, they were measured again for PAH. 12 of them went into a sauna and 12 didn't. And as you can see, it looks like that if you don't go in the sauna, that your PAH is higher at the end than with the sauna. Now, this was not significant. You can also see that there is a huge variation for the no sauna group, and that's indicated by those large whiskers that we see here. But overall, it is still something that firefighters feel that may be something that can be effective. It's the only study currently that has evaluated this. And I know that there are departments currently thinking about if they can sort of redo the study, maybe with a larger group and so on. So I think the jury is still out there. But what you see with fire departments is because they know that they have this risk, is that they try to add on all kind of small pluses to get to a significant lower risk. So for them, this is an important part to investigate. Another thing that is important for them is to think about the potential impact of PFAS, the forever chemicals. Nowadays, we know more about those, and they have been part of our lives for a long time. And we now know that they have been associated with cancer development, and that's not a very good thing. So we try to get rid of them, but obviously that's very difficult. And especially if you burn them, you can expose a lot of people, and especially the firefighters. So you can see that they are used, those PFASs, especially in areas where a lot of people live, and then specifically firefighters have been using them as part of their foam and also a part of their gear. So the issue with this type of studies is that it is difficult to determine what is the real source. You know, we know that they're in many things. Pre-post studies of fires are inconsistent. It really depends on what kind of area you are. If there is exposure, yes or no, what kind of materials were burned. Also, our drinking water and food can be contaminated with it. And then there will be large cohort effects as well. So one of the things that firefighters actively can do is try to reduce exposure. So that's the reason why the foams have been phased out. I think most of the departments don't use those foams anymore. But there is also a call for PFAS-free gear because it is highly stable on high temperatures. It sort of made sense to put them into their gear. But at the same time, they wear their gear often, so they're continuously exposed by it. So therefore, I think they really ask for free gear, free from PFAS. So there is also some talk about supplements to reduce PFAS toxicity. And although I'm a nutritionist, I won't know at all why certain supplements would work. Currently, highly investigational and inconclusive results. So, to be honest, when I came on this project, I didn't know much about it, and we decided not to go and further investigate because there is just no data suggesting that those nutritional supplement interventions will have any effect. So, what potentially can work is actually trying to remove the PFAS from the body by blood or plasma donation. So that is what the FCRP study is all about. And it is based on an Australian study that was done for roughly a year in which they had 85 firefighters with elevated PFAS, which is one of the PFASs, elevated over 5 nanograms per milliliter, which is considered high. And what they noticed was that if they allowed them to do plasma donations or blood donations, is that especially plasma donations seem to be very effective. I can show you some of the results of that study. And this is the study that sort of spiked the interest of the firefighters here in Arizona. And they said, can we do it again and see if it really works? Because there was only one study. And how it works in science is we always want to have more data to be able to confirm what we have found before. So here you see the outcomes of the 2 different PFASs, PFAS and PFHXS. On the left side, the PFAS, and the other one on the right side. Now, important is if you draw plasma, then you only draw the upper part of what we see here in the tube. So mainly the liquid water-based part. And it is thought that most of the PFAS is in that area. So that could potentially be the reason why drawing plasma is so effective in comparison to providing whole blood. Then there is another thing, is if I just flip back, you can see that the coverage of plasma donations was only 75%, but it was 6 times, while the blood donations was 100% coverage, let's say, but it was only 4 times. So knowing that if you provide plasma, and you can do that more often because that is determined by law, you can just remove more of the PFAS or the PFAS. That's the idea. So the goal of the FCRP study, the Firefighter Collaborative Research Project, is to test 2,000 firefighters. So we want to identify those with a high PFAS level. At the same time, we can also provide the others that are not with that high level with some security about, okay, in this case, for this part, probably you're fine, which is a very nice thing to let them know about what their situation is. The question is, can we lower PFAS? Will it result in health benefits? But as we expect that only 25% fits within that high level of PFAS, we thought, okay, we need to offer other interventions as well, because in the end, firefighters have higher cancer risk, they have more cardiovascular risk. So the firefighting itself is doing something on a negative end for them. So can we, for example, improve their epigenetic age? Epigenetic age, I have a slide for that. It is basically sort of a lab test for age. Obviously, we have our chronological age. I'm 43, but if I'm living very healthy, maybe my body, when you look at it, is only 40 years old. So the idea is that a lot of firefighters may be 45, but then their body is actually maturing faster. And maybe already at the age of 50. So is there anything that we can do to slow down that process of aging by measuring, the epigenetic clock and providing interventions? So that's one of the second parts of this study. So we will screen our firefighters. That's something that we're currently doing. The ones with high PFAS will be randomized in plasma, blood donation, or in a control, because we always need to have a control to see that there's really an impact of the intervention. And then at the same time, we have the group that is low in PFAS, roughly 75% of those firefighters, and we will randomize them in zone 2 training, intermittent fasting, or in a control. And the reason why we selected those zone 2 and intermittent fasting is because it is already popular in the firefighter population, and they just want to know, does it really work? Does it help to improve our epigenetic age, for example? Does it help to reduce cancer risk? And that's something that we want to try to figure out. So a very small current update is we have currently screened, the thermometer actually is not up to date anymore. We already have 44% of our initial goal of 1,400 firefighters screened here in the state of Arizona. And what we have seen is when we were analyzing their blood, that 22% of this group has elevated PFAS. And that means that they can be randomized in that specific treatment of blood donation or plasma donation. Let's see, that's where we are here. That means that, I told you a little bit about exposure, the type of exposure that they can have, and that there are potentially some interventions that firefighters can apply to stay healthy or as healthy as possible. So obviously I didn't do this all by myself. I'm only a small part in it. I'm happy to be part of that team. We have a lot of fire departments that have been already contributed. If you are with the fire department and your name is not there, maybe it's because you're still scheduled. For example, I know that we have Chandler coming up, but yeah, this is still to be continued. So thank you for your attention. If you are interested in the slides that I presented or Cynthia's slides, then you can take a picture of this QR code and you can find it back at the website of the Health Talks. Thank you.
Fantastic, Floris. Thank you so much. Yes, and the QR code goes to an archive page, so you have to scroll down to get to the Health Talks and find today's Health Talk. So make sure if you're looking for that. And I know both talks, well, Floris, I don't know if you have links, but I know Cynthia had a bunch of links too. So, all right, so we'll move on to questions. Please keep entering questions in the Q&A if you have them. So the first question is for Cynthia. Have any steps been taken to include the type of education you've done in medical schools? Great question.
It's a fantastic question. We would love to do that. That's not something that we've been able to do yet, but if anyone has any ideas or leads, that would be really great. And, one of the things is that, of course, this all really has to happen with education. And environmental medicine doesn't tend to be part of the curriculum, and that would be a really wonderful thing to be able to have for people who are starting out their careers as physicians.
Absolutely. That nutrition.
Yes.
Not taught.
Yes.
Floris, I have a question that I thought the audience might be interested in, because I know a lot of U.S. firefighters are already doing what I colloquially call bloodletting. So firefighters, U.S. firefighters, and in Australia, they're already kind of keen to knowing that they can get rid of some of these chemicals by doing the blood donations. So do you know how prevalent it is for U.S. firefighters to just go ahead and just regularly donate blood as often as they can to achieve this goal?
Yeah, to be honest, I don't know exactly. It is something that obviously I could find out. I know that Jeff Burgess and Melissa Furlan from U of A have been looking into this quite extensively. We have John Galata as a firefighter partner also on the project. They know, but it's true. It is prevalent. I don't know the exact number. So it happens a lot. At the same time, in our situation, when we now randomize people, we make sure that the ones that are already doing this as part of their normal habitat, normal behavior, they cannot be randomized in that part of the treatment group, meaning that they potentially can be part of another intervention. Which makes this very complex and interesting, because you get, in the end, a data set with many covariates and influencing factors. And that's the reason why the group needs to be that large as well, so that you, in the end, can actually look into those effects. So this is, I sometimes cannot wrap my mind around it, how big this project is and how big the data will be that will come out that we need to look at. But I think it is of invaluable value for the firefighter community, and I think for us as humans in a general sense. So I'm sorry I wasn't able to answer your question in detail, but
okay. I didn't mean to put you on the spot. I was just curious because my understanding is that firefighters are very proactive in taking charges of their health once they find out there's something that they can do to improve their health outcomes. So thank you for that. I see another question in the chat. So we have a question. How does using a phone in transit to a fire increase risk?
Yeah, so probably it is maybe something you picked up based on one of the slides where those actions were listed. It has something to do with the fact that if you're on your phone, you're not doing something else. So they use their own communication channels. And meaning in that case, it helps that you only have one line open, and that's the line that goes for direct communication. So it doesn't have much to do with this specific study that we're doing now, but I think it just increases safety.
Nobody should be using the phone in the car. All right. I have a question for Cynthia. I love that you just had a second symposium at Columbia, and so the continuity and keeping the conversation alive is, I really respect that and admire the tenacity of what you've started over there on the East Coast. Can you describe any that you know of, any effective ways that folks have overcome the challenges to implementing these toxin reduction plans, either at a personal level, a community level, or a governmental level?
You know, there's some really great resources that are out there, and I realize that I probably should have put one of them in the link of resources that I mentioned, but there are a number of different tools that consumers can use that are free and accessible. One of them is called Detox Me, and it was created by scientists at Silent Spring Institute, which is a research institute that focuses on exploring environmental links, mostly to breast cancer, but other types of illnesses that have to do with chemical exposures. And they've really put together this wonderful app that's free that really looks at different everyday products, you know, that we all use, you know, whether personal care products or cleaning products, and also just other tips for reducing toxic chemical exposures. There are also, you know, different green screens that people can, you know, access online that are also very, you know, good and research-based. There's another app that I love, which is called Clear Ya, and it was developed by someone whose wife had breast cancer at an early age. And essentially it looks at, you can put in the name of a product and see the list of chemicals of concern, whether any of them are suspected carcinogens, and the app actually gives you some safer alternatives. And there's no kind of business incentive for the app to do that. It doesn't say you should go out and buy this product, but it does at least give a grounding in how people can start to think about eliminating and reducing environmental exposures. On a more kind of institutional level, I know that different places, hospitals and universities are also utilizing their sort of like influencing their supply chains. So they're looking at different types of things like furniture that is less toxic, or maybe doesn't have, sort of like flame resistant materials. And so I think that there's kind of slow action that's happening. And I think that what this sort of points to is that it goes hand in hand with the notion of awareness that, there are these toxic chemicals out there that we really do need to pay attention to, and that, we can at least reduce some of our exposures by, educating ourselves as to what those exposures are and what safer alternatives are.
Well, one thing I used to do some work with NASA, and so I learned that this kind of snake plant, I don't know if you could see, if you know what a snake plant is, but they don't need a whole lot of light or water, and they detoxify chemicals like benzene and formaldehyde in the air. And so NASA really supports that, and another plant called the peace lily, both very easy to grow, and they're up in the space station. So if you paint your house or get a new carpet or whatnot that's exuding chemicals, these are great plants to have to help detox your space. So I have them, and they're really, you don't need a green thumb at all. You can have a black thumb and grow these successfully. Let's see. So I had another question for you, Floris, about, so let's say you have a firefighter who, has the elevated PFAS and is, but is ineligible for the study for some other reason. Is there any educational materials that you're able to supply that individual, kind of give some guidance, tips on, maybe the bloodletting, but or maybe other ways that they might help to reduce their risk?
Yeah. So one of the things is that when people are part of the screener and they are eligible to be part of the first part, then they will get their personal PFAS report. So they will get more insight in what their scores are. And based on that, we have been developing a sort of explanation sheet that we can provide to them. At the same time, the study is obviously ongoing. We will develop those materials, and hopefully we'll know more about what you can do best, within, let's say, 2 years. So more than that, obviously there's a newsletter that we send out to the participants. No focus has been on developing additional materials, but I think that's something that probably will come.
Fantastic. All right, we have a couple more questions. So a question is, are the blood donations given to hospital patients, etc.? If so, are the contaminants removed first? And I know you get this question a lot.
Yeah, and to be honest, it was the first question that I asked too, and so I totally feel with everyone here. So the answer that I got was, yeah, this is something that we discussed. It's never tested for that. It's never tested for PFAS. Maybe in the future that will change. But at the same time, it's not only firefighters that can have PFAS elevations. It depends on where you live. If you have a well that where you get the water from, that is contaminated, maybe you actually have a higher level. So potentially people give blood that also have those elevations. So the blood banks currently go with the fact that they have a shortage. So sometimes it's better to give blood or plasma instead of not being able to give anything. That's the story that I got. Yeah, so that's how far I can say. For now, that's what it is. We we explained it to the blood banks that we working with, that we sent the firefighters to. They can pick their own if they want to, but we have some made some arrangements so that they can sort of skip line or try to skip line, that kind of stuff. And that's what it is now. But let's say this is an upcoming field of interest, so maybe in 10 years it will be completely different.
Yeah, I recall that you pointed that out, that the blood banks don't already test for PFAS. So just you get a pint of blood and usually you're going to be quite grateful for it because your condition is dire. That's why you're getting a pint of blood or plasma. So that's a great question though, came to my mind. Any other questions? We have time for a few more. I'm out of questions. You guys have questions for each other?
I put into the chat that you can find the Detox Me free app from, if you Google Silent Spring Institute. So and it's also available on the App Store. So if you look for Detox Me, you can download that. And it really does have a lot of very good tools and strategies for reducing exposure to toxics.
Fantastic. All right. Well, if we don't have any other questions, we can wrap up. I want to thank you all again for joining us today. That's all we have on this topic, but we encourage you to follow the College of Health Solutions on social media. We have the social media channels now posted there on the screen, so you can learn about other opportunities to learn with us like this one. Our Health Talk series will continue next month with a presentation called Psychedelics as Therapeutics, Current Science and Clinical Applications. That talk will take place on Thursday, November 16th at noon Arizona time. Details and registration will be available at asuhealthtalks.com. Thank you again and have a great rest of your day.